The Safe Sleep Baby campaign is an educational component designed to teach our Black parents ways to sleep their baby to prevent sleep-related deaths properly.
So we noticed that the problem was that Black infants were dying at a much higher rate than any other ethnicity here in Sacramento County, 2 to 3 times the rate of their peers.
And we never really understood why. And so we started to gather some data in Sacramento, and we found that there are certain risk factors that seem to happen frequently in sleep-related deaths. And from that, we came up with the message, to be very simple, to talk about all the various ways that you can really help to prevent sleep-related deaths. And that is what we call the ABCs of Safe Sleep.
So the ABCs of Safe Sleep Baby are A, always alone. So baby should be alone, although sometimes we feel the closer they are, the safer they are. Oftentimes we find that babies being close could actually increase the rate of death.
B stands for on your back.
Sleeping on their back helps with, not just breathing, but if they're on their stomach, if the baby vomits or has anything that may get in their mouth, it actually can prohibit the breathing and the airflow and a bunch of other things that can occur when the baby's on their stomach.
And C stands for a crib, which essentially is saying the child needs to sleep alone, on their back, and in a crib. And a crib could be any safe sleep space, basically anything with a hard surface with nothing else in it.
We care about you, we're invested about your family, and we are extending a tool that we believe could be helpful to you.
What was really nice about this program and what we were really proud of is the way we were able to integrate all the health systems in the Sacramento area. That would include Kaiser Permanente, UC Davis, Sutter Health Systems, and Dignity Health. All of them receive training and the information to help to convey this message. So again, we could have a universal approach, no matter who you are, that you will get the same approach to talk about how to safely sleep your child, to give you the best chance of having your child not die in their sleep.
We have a support group called Black Mothers United. They have these things called Mommy Mingles, where they have these classes where the moms come in and they do different types of projects. They get to hear from elders that have had children. They get to do things like yoga and self-care practices.
So the Black Child Legacy campaign was a very helpful campaign for getting our message out. Numerous community incubator leads, basically centers where the Black Child Legacy resides in each community, especially in the at-risk communities.
Families are not only hearing about the ABCs in one incident, they're hearing from their community support, they're hearing it from their case managers, they're hearing it from their doctors. We've been able to get the buy-in from official hospitals who are committed to engage in this practice.
Having these relationships helps reinforce the training, and it also helps for those medical professionals to understand and realize how important our work is.
The question we receive a lot is, how do we know how we're doing? How do we know how the Safe Sleep campaign is working? And the easy answer to that is we check to see how many children are dying in their sleep.
Things like the 2020 census data, we have seen a 54% reduction in infant sleep-related deaths here in Sacramento because of the Safe Sleep Baby campaign.
With this 54% decrease, I think it tells that the community is trusting of the folks delivering the message.
So the continued commitment in terms of where Safe Sleep Baby is, where it should be, 60%, 80% reduction in deaths. How about 100? No deaths at all, right? That's where it needs to be. That's where the mindset needs to go and take us so that no babies are dying.
Black kids deserve every opportunity that anyone else has.
Black kids deserve an opportunity to live and to thrive.